All right. Well, hello, everyone. We're so glad to be able to join you today and share a few of our insights and information about engaging with high school students and special collections. Before we get started into that, though, literature says it's good practice to sort of introduce ourselves and tell you why we're here talking to you. So here's a little bit about us and our background. So I'm Carrie Meyer, and I have the pleasure of serving as the Associate Professor and Associate Dean of Special Collections and Archives at the McGugin Health Sciences Library here at University of Nebraska Medical Center McGugin Library. But for the rest of my life, I'm married to my wonderful husband of 11 years, Josh, who you can see pictured there holding our daughter Everly, who's 6. Our son Owen is 8, and he's very proudly showing off his newly lost teeth in his grin there on the right-hand side. And we also have 4 fur babies, one of which is pictured. That is Mora. She's our wonderful golden lab. The other 3 are of the feline persuasion. There's Skittles and Casper, who are our tabby cats, and Pepper, who is our black 19-year-old kitty cat. She's an old lady, but she's so super sweet. So my degrees and background are in art history, museum studies, and history. And work-wise, I've spent 15 years in the private sector in the museum world as a curator, and then 5 years in academic libraries and special collections with essentially a similar focus of museum, exhibition curation, formal and informal education, um, preservation, and leading an amazing team of archivists, scholars, and curators, one of whom is joining us today, and that is Erin. So I will turn it over to Erin to introduce herself.
Hello, my name is Erin Torell, and I'm the Rare Book Librarian at the Leon S. McGugin Health Sciences Library. I have been married to my husband for 16 years, and we love to travel. I love to read, bake, and garden, and we love our cats. Left to right, we have Penelope, who's doing her best Sphinx impression. We have our brown tabby slugger. He's our oldest cat. Our orange wild child, Kit. And on the right, we have our very special case, our orange and white named Frida. She was abandoned. My husband brought her home, and she turned out to be pregnant. So we fostered 5 kittens, but we kept the calico we named Layla. I have my bachelor's and master's degrees in history. Out of grad school, I worked in a museum and archives. I've also worked in public and school libraries. I've worked at the Leon S. McGugin Health Sciences Library um, since 2010 and as the Rare Book Librarian since 2018. In my position, I curate the historical book collections, I provide instruction and programming with the collection, I do reference services, and I also create exhibitions.
So today we're going to be talking about lots of different things, but very broadly, these are our objectives. We want to discuss some of the safe usage practices of primary source materials for in-person and online, things that we've done that worked well, things that you might already be doing yourselves, but hopefully there's some new ideas there as well. We want to discuss our lessons that we've learned about learners pre, during, and post-COVID, because it is definitely different. And it's different not only in learning styles, but also expectations and outputs that we've noticed with our students. And then we hope that you'll be able to discover some ways of interacting with students of all ages, because these activities and things, they're scalable. We end up working with them with high schoolers, but they could be applicable to lots of different age groups. And so specifically for us, we'll be showing you how we've used them with high schoolers interested in health science careers. And we hope that some of these ideas might allow you to broaden your audiences into high schoolers if you don't already have some, whether your institution has a pipeline program or not, in a way that's a win-win for both institutions.
So what is the High School Alliance? The UNMC High School Alliance is essentially a pipeline program. It is an immersive experience in the health sciences professions where students learn from experts and practice hands-on skills. The program is an inside look at what being a healthcare provider or researcher is like. Courses cover a range of topics in the healthcare world, such as infectious diseases, anatomy, and medical decision making. And they're taught by UNMC faculty on the Omaha campus. Students come from public schools around the Omaha metro area, and they get to form connections with world-renowned doctors, researchers, and other healthcare providers. In early 2021, the library dean, in conversation with the director of High School Alliance, recommended that I speak with the director about how special collections and archives could teach a health humanities course that had already been developed by a faculty member who had left UNMC. Special collections and archives holds unique objects, rare books, artifacts, archival materials that would bring a special experience for students. The course, The Art and Science of Decision Making, was created by a College of Medicine faculty member several years earlier. There are required components that must meet the school district's science requirements. That has been difficult. We are historians, we are not clinicians. Despite not being clinicians, we have navigated the science requirements with the assistance of guest speakers and tailoring our instruction to the objectives. Participating in High School Alliance has provided an excellent opportunity for Special Collections and Archives faculty to create lesson plans and rubrics, otherwise gaining experience in semester-long instruction. It's a unique opportunity for Special Collections and Archives faculty. I feel like I'm going to use the word unique a lot in this presentation, and that is what is kind of defining our role, but also our collections. What are the health humanities? Sometimes a picture is worth 1,000 words. This is an AI-generated image. It is visually what we are trying to communicate about the health humanities to our students. The root, the stems of this flower are the hard sciences. They are rooted things in life, concrete, evidence-based, etc. The humanities then are the beautiful flower that sprouts from these more concrete disciplines. The goal here, while imperfect, is to show that it is necessary to have both for a well-rounded mind and life. So our goal has been to teach skills to health professionals and students that they can then apply in their lives, in their careers, such as listening, observation, empathy, critical thinking, and the acceptance of ambiguity. We emphasize self-care in this as well, since it is well documented that burnout and emotional fatigue are incredibly high in health professions. We introduce our students to this concept in a bit of a forewarning to prepare and guard against it. We also try to illustrate that medicine is an iterative profession. We present the history of the professions to illustrate why things are the way they are, how they got here, and to teach the historical empathy of standing on the shoulders of others to get to the point where we are today. We then encourage them to imagine where that will take them next.
So, with that introduction, what did we do and what did we learn while doing it? And so, the next section, which is the primary bulk of our presentation, is going to go through a series of exercises and activities and things that we did that we hope will spark some ideas for y'all. But at the same time, these are kind of the three buckets that everything that we're going to share falls into. Um, we've tried several things with various amounts of success, and so we're related to health humanities, we're going to be very transparent. We're going to share some things that worked and some things that didn't, and some things that kind of worked and need some help. Um, so, some things have resonated really, really well. Regardless, we encourage you to take these lessons that we've learned, use them yourselves, improve on them, change them around, take these ideas and, make them work for your collections, instruction, outreach, things like that. The biggest takeaway, just to start with, is in that very first bullet. COVID truly changed everything, and that just It's like, yes, that makes sense. Um, but we had one semester, and we've seen this in practice, where we had this first semester of students who actually came to us during COVID, but their education prior to coming to us in COVID was the normal, what we would consider the pre-normal, um, then normal, I guess is a better way to say it, instruction in the public school system. And they attacked a lot of these activities and they loved it. They did very well. In fact, our feedback was don't change a thing. That's a direct quote. Don't change a thing. One of our students said that when we opened up the floor for ideas. And so we were like, great, let's just do this again. Well, that advice did not serve us very well in the next semesters because COVID. It was the unknown variable. And so we found that the instruction environment changes that the students were having prior to coming into the program changed so much that the expectations and outputs that our first group of students did so well with really set up our second and even kind of our third group of students, kind of set them up to fail a little bit. And so we've been pivoting on all of these. And so we're going to share some of the good and bad with that. And one of those is this first project. So when we first designed the course, we said, how can we center communication and artifacts and the history of healthcare discovery and innovation? So we thought, let's have them have an individual research paper, and then we'll create a group project where they get to create an exhibition plan that encompassed a topic of similar interest. So, for example, the students interested in midwifery and obstetrics were writing their own papers about that topic in various areas. And then we grouped them together to create an exhibit to focus on that same topic, and from which their individual research interests kind of blossomed. So it was both projects intertwining. Now, why are we having health profession students do an exhibit? They're not historians, they're not public historians. So the goal here is that they would ultimately have three simulated communication levels to operate within. So the first being that visual communication. How do you talk to folks with space, with color, with layout? Then the second level would be the non-expert. How do you talk to people that don't have a background in your topic, maybe haven't read up on it? And then how do you talk to the expert? So specifically, the exhibition labels, they started that was the non-expert. How do you explain and break down a concept without making someone feel stupid? Don't talk down to them. How do you engage them on a common level where you know more than they do, i.e., a doctor and a patient, and not make it feel like they have nothing to contribute, and make them feel like they're part of the process. So that was the exhibition label component of this. The physical exhibit was the opportunity to think about how to communicate visually with people. How do they move through the space? How do they absorb information? What's overwhelming versus too sparse and not really answering their questions? So really utilizing that exhibit space to understand a different way of communicating with people more visually without so much the big words and the jargon. And then the expert was their research paper. They've researched it. Tell me your position. Tell me, how you've become an expert in this subject through this semester. So it was really the three different types of communication was the goal. The first students, this was the midwifery students. This is what they produced. It was wonderful. They had great labels. They had wonderful papers. They poured their hearts into this. And so oops, excuse me. Sorry. I hit the wrong button. They really poured their hearts into this, and so this was the output. It was wonderful. But since then, the students really struggled. Post-COVID, we noticed a decreased tolerance for ambiguity in assignment parameters by students. And so we had to, where the first group, we just gave them this outline and they met as a group. They established their own deadlines. They pulled things together, and we didn't have to do a lot of that. Since then, we've really had to focus more on teaching time management, writing and research techniques instead of these larger creative assignments. And so this portion of the project has sadly gone away, but we still think there's a lot of value in this. I think if you can take this into your student or resident or higher education group and incorporate this into lots of different ways, really focusing on how they're communicating. You could utilize special collections in this way in a variety of disciplines. Um, because if you have the stuff and they still have to do the research, but it's how do you communicate with it? So while sadly this has gone away for us at the moment, we definitely are exploring how to bring it back in various other outreach activities or with other classes. Um, it's just the really unique experience that comes out of special collections, and we think it has great value for students and proves that the collections can be more than just stuff in a box somewhere else. So hopefully this will make a comeback. An activity that did and continues to resonate really, really well. It focuses on oral history and interviewing skills. So this is a class favorite. Um, and in this situation, students are presented with folks giving first-person accounts of their experiences in healthcare settings. Our interviewees here are volunteers from our colleagues in the library, and they were comfortable with sharing some of their personal stories with students. Uh, we benefited from the fact the library has done several living libraries, and our folks had participated, so making this ask wasn't that far out of their lane. They had already shared these experiences. And so we were very comfortable walking in and saying, "Hey, would you mind doing that with our students in a more, one-on-one setting?" So the preparation the students were given were these slides, these four different slides. Um, they then selected two folks that they wished to interview. And so within that, they had to create their own questions. They had a minimum of two for the assignment. And the goal here was to create at least two questions designed to elicit more information from the person. The students were asked to keep in mind whether their question gets the information they wanted, and if not, what information did it get? And then how could they have asked something differently? And then they have, after this 2 hour session with two different interviewers, they would have a reflection assignment that they would evaluate how they spoke with the interviewers, what came out of it. And they also did a confidential thank you note to the speakers so that they could speak to them one-on-one even afterwards. The first time we did this, Erin and I were admittedly like, what happens if no one asks a question? What happens if they ask their two questions and then we sit here for the next 40 minutes? And I'll be honest, that has never happened. The students have always, they started with two questions, but they've asked follow-ups. And a lot of the reflections have been, I had no idea, you know, my first questions were so wrong, and then my follow-ups were getting more to the heart of what I was trying to ask for these situations. So it's been universally positive. In fact, I just heard this week that some of our other librarians have been working with this year's crop of high school Alliance students who are going to be our next semester students in this very class, and they're looking forward to this because they've heard about it from the stellar seniors who've come back another year. So they want this interaction because they learn so much about themselves. And it's a great way to understand how they think and how what they think gets responses from other people. So it's really about building empathy in their health around healthcare experiences, how to talk to people, and the responsibility that comes with sharing and receiving a story in the healthcare setting. So this has been a really great uh, activity that the students have done. And I don't know how, but maybe we can expand it even farther. But I think it has much to teach with the students.
I use rare book primary sources to introduce the concept of informed consent. I do this by presenting three case histories in the form of historical publications, and I use William Beaumont's Experiments and Observations on the Gastric Juice and the Physiology of Digestion from 1833, J. Marion Sims on the Treatment of the Vasovaginal Fistula from 1852, and Edward Pernkopf's, and I'm going to do this poorly because I don't speak German, Topographische Anatomie des Menschen from 1943. So we hold these titles in our rare book collection, and what they offer just a wealth of discussion points about research ethics and informed consent. So I have presented this to high school alliance students, but I've also presented it to college undergraduate students in our summer undergraduate research program, also called SERP. The presentation highlights the history of the medical field to help future health science students develop history-informed professional identity formation. I don't think many health science students actually know the history of the field they are entering, or how events of the past are still reflected in modern healthcare, such as racialized medicine and health disparities. The health humanities are an avenue to provide students and faculty with a historical background that builds empathy, and I do that with the rare books. So how do I actually use rare books in the classroom? So these are two photographs from the classroom setup we have in the library. And I use the technology that is built into the classroom. It is integrated with audience and presenter cameras, 6 screens, and Echo 360 recording system. So the image on the left shows the audience camera that's in the front of the room, and the image on the right shows the presenter camera, which is located at the back of the room. This is our Special Collections and Archives colleague, Darby, and she's demonstrating how we use the camera system. So we use the audience camera, and we use it like a document camera by turning it all the way to face down. We move a table with the object directly under the camera, which allows us to zoom in on books, documents, or whatever we want. The image is projected onto the screens in the classroom, and this allows the students who are in the classroom to view the images projected either on the large screens or 4 of the pods that are on the walls. The camera system provides students with high quality views of special collections and archives materials online as well. We use Zoom and Echo 360. These images I cut from a recording of a rare book presentation I gave using the classroom camera system and Zoom. We can move between the presenter camera, the audience camera, which is zoomed in on books where we are flipping pages, and we can then move from the camera system to a PowerPoint slide. Carrie and I would never have thought to use the technology in the classroom in this way. And so it's many thanks to our McGugin Library digital technologies librarian, Brian Maas, for developing this idea for us. I had originally wanted a document camera, but Brian came up with this idea, which is free. In this image, Darby is using the camera to zoom in to show the details on an artifact. In this case, it's an infant teether. Other ways that I use rare books in instruction. I have used rare books in our high school alliance course for hands-on activities. And unfortunately, I never remember to take any photographs of doing this. So got to remember to do that this year. I must be mindful of the proper handling, of course. Always keeping an eye on how the students are handling the books. And I also have to be careful about how often books are used for hands-on activities. I don't use the same books every single year. I also will sometimes bring in books and just set them on a table at the front of the room, and students, if they choose to, can come and look at the books during a break. I will also bring in facsimile copies because I do feel more comfortable with more repeated handling of those books. But if I want to show images from the books, but I don't want the kids to handle the books, we use our camera system, and that way they can look at it on the screens around the room while we discuss them live. I encourage students to use our rare books for their research papers and in those first 2 years for their exhibit projects. The students also can only use the books while in the library, and we have dedicated time in our schedule for working on projects and papers, and they use the books during that time. Something that we are working on creating is education collection. Maybe you have an education collection. In the future, once our education collection is set up, we can use those books for classroom activities. While our classroom technology provides an easy means to highlight materials, we have used our phones as well. We have provided hour-long rare book presentations using Carrie's camera, the phone on her camera phone with a steady cam, and she would move book to book, image to image while I talked about them. We set up the books in our researcher reading room, and we just moved around the table. We've done this without a Steadicam, and as Carrie was the camera person, she can attest to the fact that it is much better with a Steadicam. Otherwise, images can get a little wobbly. These presentations were virtual only. We recorded them, and what's great about, recorded presentation is you can use them over and over for different audiences. I also use scans from our rare books. We do have an overhead book scanner, but I don't think you actually need a book scanner. Our phones today have really good cameras that take very high quality photos. I use scans in my PowerPoints for classroom instruction, for presentation, and other programming. The two images here on the left, we have an image of an amputation from, once again, I'm not going to do justice to this, Feldbuch der Wundtornsny by Hans von Gierdorf from 1517. And on the right is De Corporis Humani Fabrica Libri Septem by Andreas Vesalius from 1555.
So Erin shared so much about how the wonderful things go on with the books, and I have always loved her consent lecture that she did. And she has done that, as she said, several times. It makes wonderful sense, highlighting how you need to have consent in healthcare research. But in our downtime between classes and things, we'd be talking, and I did inevitably bring up some dastardly deed that I had learned about some physician from the past and the horrible things they'd done to their patients. And admittedly, I'm a true crime enthusiast, so I'm constantly watching these true crime documentaries. And we're talking about these things, and I was always looking for a way to bring this into our class. And truthfully, I just wanted to talk about it. And I was like, there has to be a link to these students because I just really find this fascinating. So as we were talking, we thought enter ethics and medical regulation. And the book by Sarah Rodriguez, The Love Surgeon, really solidified this idea for me. So we took my fascination with this subject and grafted it with Erin's lecture on consent to form a two-part lecture series that talks about power dynamics, control, and trust within healthcare, and how those things can come together to let some types of people do some pretty nasty things to other people. Um, and we started looking at the primary and secondary source documents of cases of healthcare homicide throughout history. So this was the kind of basis idea of the class. And so I would task students. I did the research beforehand, and they we would only choose those who had been convicted. We weren't going to deal with the speculative. It was those who had been convicted of these types of things that were working in healthcare and did dastardly, horrible things to their patients. And so I selected a variety of names from various points in history. Unfortunately, many are present day. And so this is a picture of the slide of one of the slides from my PowerPoint that shows some very recent, unfortunately, cases of healthcare professionals not being great stewards of their patients' health. Um, so the students were tasked with different names, and their goal was to find the commonality amongst a variety of these historic and modern healthcare killers, these situations. Who they are asked to figure out who are they, what's their background, where did they work, what was their motivation, how many times did this happen, and in how many institutions. So it's not so much about the macabre nature of it. It's really looking at how did this happen and how did it happen so long? And that's how it comes back to ethics because spoiler alert, with majority, well, I'd say all of these situations, the colleagues, supervisors, healthcare administration noticed something was off. And so many of the primary sources in the newspapers and different things, they would talk about how, yeah, it just never seemed right about X, Y, or Z interaction that happened. But these folks also didn't say anything. Or if something was raised, and this is where the administration came in, the problem person was moved off to another unit, facility, or country in some cases, and allowed to continue their activity. And so at the end of all of this, after all the students have presented about their historic person, have given their thoughts on how they were able to do all of these things, we bring this home with them as future healthcare professionals. What will they do if they see something? And this is where the ethics piece comes in just really strongly. Um, and so this has been another really well received lecture, which, you know, it's sad that we have to talk about it, but I think it is important because I think it's very easy to read about historical folks who've done things all the way back to the Renaissance that have been documented and go, oh, that doesn't happen today, but it does. And it's constantly around us and it could happen at any time. And so all this to say, um, sometimes your tangential interests can be combined with your correct collections and your instruction to create some really interesting and unique programming that students find valuable. And then you also get to kind of indulge your personal interests on the side. I will tell you, I was actually rather um, taken aback at how many modern cases, like within the last 40 years, there have been of instances of healthcare homicide where people have been convicted in various professions, and started looking at some of the statistics, and I had no idea. So it just kind of started with the germ of an idea and has developed into a session that I think is very impactful for our students.
Page here. Okay. So we like to use art. And if you're not familiar with visual thinking strategies, I'll explain that to you in a moment. We use art related to the medical field. And I'm on my wrong slide here. Hold on a second. Here we go. Um, yes. So health visual thinking strategy is very popular within health humanities. What I'm showing here is the title page from Andreas Vesalius's book from 1555. And what we do in a visual thinking strategy session is we have a kind of a guided discussion with open-ended questions that's designed to help the participants strengthen their observation, their listening, and their verbal communication and critical thinking skills. These are all skills that are really important for healthcare providers. So those three questions on the screen, those are the only questions that you ask. And you're trying to prompt the participants to think, but you're not guiding them. You're not really trying to influence what their answers are. They must really, really look at the art, their observation. They need to be able to verbally communicate what they see, and then how they interpret what they see, backing up why they interpret it that way. You're listening to each other and you're thinking about, well, how does that observation by my classmate or that interpretation change how I think about the art? I like to use art that's related to the medical field in this. For instance, we have this work by Frida Kahlo that I use specifically in a module where we talk about patient experiences in communication. And I've also used the artwork on the right, which is about the 1793 yellow fever epidemic in Philadelphia. Any art will do for visual thinking strategies. If it's really visual, has a lot to see, it's going to work too. Carrie and I try to introduce different humanities fields to our students, and that includes poetry. I have used the smallpox poem by Lady Mary Wortley Montagu in discussions on the history of smallpox inoculation and in exploring patient experiences. To share some background, Lady Mary Wortley Montagu was born in England in 1689. In 1715, at the age of 26, Mary contracted smallpox. She survived, but the disease left her scarred and she lost her eyebrows and eyelashes, and it would actually kill her brother. In 1716, Mary traveled to Turkey when her husband was appointed the ambassador. And it was there that Mary learned about smallpox inoculation, which is also called variolation, and she had her 5-year-old son inoculated. Mary took it upon herself to share this procedure with the citizens of England. And after her family returned to England, another smallpox epidemic broke out, and Mary had her daughter inoculated in the presence of the royal doctor. Mary really wanted to convince others, especially mothers like Princess Caroline, to inoculate their children. Mary's poem describes a woman's life and how it changes after smallpox, when she loses her beauty and due to the scars and the hair loss, and how consequently she loses her many admirers. I have discussed the poem in conjunction with her role in popularizing smallpox inoculation in England, but also her personal experiences as a smallpox survivor. And as far as 18th century poetry goes, Mary's poem is pretty easy to study. I've also used modern day poetry written by patients and providers as well. Poetry is an excellent way for students to work on observation and critical thinking and to learn how different experiences can be shared. In conjunction with studying poetry, I've used old book pages to allow students to create their own kind of blackout poetry.
So another idea that has resonated with this class and which I'm interested in exploring in different ways for the variety of audiences is how collections of children's literature can be used to teach complex topics. Now, you saw my kiddos on that first slide. Um, this is admittedly a result of my kiddos being in that age range where I've had the opportunity to read and watch things over and over and over and over. So I love them dearly. And as I was doing this, um, this repetition allowed me to see another way to instruct using current cultural artifacts. And so in this case, I used Bluey. Now, if you do not have young children in your life, you have never probably had the pleasure of watching Bluey. But on the grand scheme, it's one of the shows that can also be entertaining to adults. So God bless those writers that took pity with some of the jokes for adult audiences, and they are humane 8 minutes each. So each episode's only 8 minutes long. Um, so, as a background, Bluey follows the Australian healer family, Mom Chili, Dad Bandit, and the sisters Bluey and Bingo. Bluey and Bingo in season one are about 4 and 6, and the show centers around their games of pretend. And each episode is some kind of game that teaches a lesson or has a moral or unpacks some more complex thought about life and growing up. And so in season one, there are two episodes with medical themes. They're called Hospital and the Doctor. And in watching these over and over and over again, and in conjunction with teaching this class with Erin, I started to see some themes. Um, and it was what's a good healthcare experience and what's a not good healthcare experience. And from the show's perspective, they're trying to, bring out how going to the doctor is not scary. It can actually be a really good thing. And so the cases that the doctor is seeing are very extreme, you know. But the point that I wanted to drive home to our students was there's a good healthcare experience and there's a bad healthcare experience in both of these episodes and what makes them each that way. So in class, the students would watch each of these episodes and then they have these guiding questions. And so you can see them there on the screen. This is from the one related to hospital. So Telemachus is the dad's character, and Bluey's the doctor, and Bingo's the nurse. And so as they're going through, they have to write some initial, they're watching this 8-minute kids show, and then they have a few minutes afterwards to write their initial thoughts. And then we bring them into small groups to discuss who saw what was interesting to these different folks, and then we come back to the larger group. And so you can definitely see from these questions, I'm focusing them on the patient and provider relationship. Now, why? And this was one of the things the students asked. Why are you having us watch this thing for like little kids? Things written for kids have a great way of getting to the point quickly and clearly. They utilize the extremes to make the points that can get lost in the nuance of adult education. Um, I've only done this with our last class, so it was only it's only been done once. I'm going to do it again this next semester. But that initial reaction was, really? You're having us watch a cartoon from these high schoolers who are way too cool for this. But then following it, the feedback showed that they were succeeding in understanding the qualities of a good patient care experience versus a not so good one. So, how their words, their body language, their actions could have a significant impact on how people think and feel within the healthcare situation. And because they were able to see how Bluey, as the physician and the doctor character, is coming in and has the not so good reaction, they also then see how the patient reaction happens after Bluey leaves the room. So they have that third person viewer of seeing both sides. And so they were able to then see how when the good patient interaction happens, how everything changes. So with these questions, it was a 2-hour class, all of this from an 8-minute cartoon of a talking dog. So that's a really great opportunity to utilize maybe some similar things in your life. If your library is so fortunate enough to have a children's literature collection, that would be a great use of it, I think, in lots of different disciplines. And of course, we've talked about all these other things we've done, but we always try to bring in the artifacts. This is one of our staples. We have access to these collections. We want the students to use them. And so 3 of these images are from during the COVID times when the students were using them for their exhibits. The last one, though, is an in-class exercise. That's the one on the far bottom right, where these students are examining a pharmaceutical collection and using observation and research skills to determine what the medications were used for, why that specific formulation, looking at the materials, design, and manufacture of the bottles to see what they could deduce and how these were used. So, for example, in one of these cases, there was a specific design change to the side of the bottle on this particular medication that changed it to jagged versus the normal smooth. And the jagged design of the bottle was to warn the pharmacist, should they accidentally grab that bottle's not for human consumption. So it was the physical material change and then also the labeling had a different look. It was the black ink on the safe one and red ink on the one that was labeled poison, to really drive home that point. So those were some of the things that they had to sort of look at their bottles, look at these medications, and try to deduce from this interaction with the artifacts. And so these are always popular. They teach more skills than you think. Just being able to come up with a few guiding questions and let them touch stuff, is just really, really a potent activity. They have close observation. There's research involved. There's that critical thinking, um, and we utilize this also with our surgical instruments, anesthesia artifacts, obstetrics artifacts. You know, we did try to this picture here with the students or with the amputation kit. We did watch that closely because those are still very sharp. So, but they were good with them. And then other fun and games that we've done, again, these are more of the traditional types of interactions where we've brought in guest speakers, very generous with their time and expertise. The large image is our guest speaker, Beth Beam, who's a PhD and a registered nurse in the College of Nursing. And she actually developed PPE protocols during Ebola. That's what she ended up getting her PhD in, was related to PPE. And then she was instrumental in the protocols developed with COVID. And so when we got to more of the modern times of our historical instruction of innovation and design, we brought in Beth because she is the person who kind of came up with all of this and innovated all of this. And so she actually took the students through a doffing and donning activity, and they had to design or they had to figure out how to dress their student colleague and how they should put things on in what order and how to take them off. And so Beth would, throughout the thing, instruct them on why this is important. And some of these students may end up in infectious disease. Regardless, I definitely want them all to know the proper techniques. And so it's introducing them to something that can be very serious, in a very fun, interactive way. And so she would, I think what she's putting on there right there is mustard on the students' gloves, so that once she had everything on, she put the mustard on the gloves so that symbolized the contagion. And so then as she was taking it off, did mustard transfer so we could see if that doffing technique was actually working in a good infection protocol. So it was quite fun. The students really seemed to enjoy that. Um, some other things that we had to do with some of our guest speakers, we brought in our colleague Darby again, who you saw in some previous slides. She introduced a bit of the public health history in Nebraska and from UNMC related to our unique role in biopreparedness as well. And as part of her lectures, students had to create their own public health announcements, as a group. And so that's what you see in that top right image. Unfortunately, we are terrible at taking pictures, and the whiteboards that these students produced were amazing. And somehow we didn't get any pictures of the finished product. But really, they each had a category or a campaign that they were trying to do, and they designed on the whiteboards how they would go about educating the public on what to do or what not to do. So one had a hand washing campaign, one had a eat your vegetables campaign. It was how, again, more of that visual to lay audience education, in a fun manner. The middle picture there, again, is kind of hard to see, but this is related to our graphic medicine course. We brought in our colleague Jess King, is one of our education and research services librarians. She pioneered putting together a graphic medicine collection in the library. And so she introduces themes found in that collection, in a short lecture at the beginning of class. Um, Provider, patient, caregiver perspectives, and how the art enhances their stories. And so we then have the students build their own graphic comic in a 6-frame series that illustrates, again, another campaign or social issue. And this provides graphic medicine in general provides an opportunity for accessibility with empathy and building empathy amongst personal student or personal story experience. And so the students had fun creating this comic. And so what they would have to do is they had their six comics and they had to pass it around, and each of them had to sort of draw what the others were describing and build on the story in this graphic medicine exercise, excuse me. And then the last one here is it was Erin's idea. And talking about Civil War medicine, you're talking about amputations in a lot of cases. And one of the things that you continually end up seeing is how speed was a important factor. And so the bottom at the right shows students participating in the amputation game. It's a speed game of can they correctly order the surgical tasks from one to I think it's seven or eight in the correct order in the least amount of time. So they get with their groups, they're given photos of the items needed in an amputation in the mid 19th century. They're all items from our collection. You saw one of those kits in a previous slide. Um, and so the students worked against the clock, but they still got to work together. They might not know what each instrument does, but they use context knowledge to put it together. And so then at the end, they discuss each instrument or item from chloroform to tourniquets to bone saws. And so it's just a really unique way to drive home how you'd have to use all of these things in a short amount of time and get it in the right order.
Throughout the talk, we've thrown out some ideas of what you can do to replicate, to improve, to ideate ways to connect to students using special collections. Perhaps you're even fortunate enough to be connected with a library with non-healthcare related special collections that you can come up with using in unique ways as well. But in the time remaining, we want to share some other ways in which we've used these activities and classes for more audiences to provide some suggestions of where you can go to develop interest among students using the collections. The McGugin Library's special collections and archives have a rich array of rare books and artifacts that can engage students in the classroom and even participants in online presentations. What unique items do you have in your collection? Do you have items that tell a story that's specific to a field or your institution? Your library may have a book that is held by many libraries, but you can still tell a unique story to viewers who have little to no knowledge about the history of the health sciences or about your institution. I'm sure your community is like ours, and many don't even know you exist. Or if they do know you exist, they assume the collections are hidden behind guarded doors. Bringing collection items out, even in the online world, can literally and figuratively open doors. Not including primary source, hands-on activities. Much of what I do with Rare Books with High School Alliance courses I've used for college students, faculty, and staff. From an instruction standpoint, one of the good things that come out of COVID was challenging ourselves to provide instruction and programming virtually. How to use Zoom and all of its features, and how can we use our phones and other equipment in our classrooms and reading rooms. Rare books, archival documents, and artifacts can be shown for instruction and programming online. We have learned to seek advice from others and to think outside the box. We were particularly inspired by the Becker Medical Library at Washington University in St. Louis. We wanted to do something similar to the virtual rare book presentations they gave when we were working with our College of Allied Health Professions. We contacted them and they were very gracious in sharing their knowledge and experience. And we discovered they were just using their phones. And that is how we did our very first virtual rare book presentation during COVID. We, like you, have discovered that virtual events, born in necessity during COVID, have helped us build the skills to provide access to special collections when individuals cannot or do not wish to come to campus. While we here at McGugin Library have returned to in-person instruction and programming, we continue to provide virtual option because it opens the world. And I literally mean the world to your collections. The images in this slide show an open house I held last fall for a sonography course in the College of Allied Health Professions. On campus, students would visit the library, view the books, and interact with me for continuing education credit. The next day, we provided a virtual rare book presentation for students and others who could not come in person. Having digital images of the rare books means I can travel to locations for presentations. While I'm willing to bring the rare books out of the library when conditions are right, having digitized images means I can travel to students more easily. This summer was the first time I traveled off campus to present about the history of the informed consent. All I needed was a computer to show the PowerPoint. Not having an established pipeline program at your institution should not be a deterrent from working with high school students. Your local schools have science and history requirements for each grade. Does your institution have materials that can fit? By partnering with high school teachers and librarians, you can share your unique collections and help teachers engage with students in a new way. Teachers are always looking for resources, and if you have a virtual program or opportunity that doesn't require travel dollars for buses, they'll likely be all ears. Cold call or email a school and ask how you might provide information to teachers about your free primary source related program.
And so nothing that we've shared today is necessarily rocket science. And you may have tried some of these things in the past and they haven't worked. But our encouragement is to keep at it. Each program, virtual session, meet the curator events, or open house is just one more way to show the value of the special collections. And if you are not in special collections or in a library and you're in this program, please reach out to the library at your institution. Chances are you will find some way to partner and you can bring in more hands-on, unique, and thought-provoking instruction into your classroom. So thank you all so much for listening. Definitely appreciate your time. Erin is available to take questions live. I unfortunately had a commitment that didn't allow me to log in at this time. So many thanks to the special interest group for allowing us to kind of pivot on our presentation today. But she is here to take questions. And if you don't have time to stay, you don't have an opportunity to get your question answered, you want to share ideas or brainstorm, please don't hesitate to reach out to us. We'd be more than happy to email and chat with you. So thank you so much for your time, and we welcome questions.